Hi, I'm Nick Sally, and my partners are JP Caglone, Garrett Schwarter, and Jonathan Earl. And our topic was binge drinking. Sometimes as college students, we tend to choose a university for the wrong reasons, such as partying, a great football team, or either just simply off of who's the latest with the drinking. So that can turn over and be a bad thing in some situations, especially when it comes to binge drinking for people who repeatedly do it over and over again. So some facts real fast for you is according to the National Survey of Drug Use and Health, Monitoring the Future and the National Epidemiology Survey on Alcohol and Related Conditions, excess binge drinking is defined as consuming 5 or more drinks in an evening. Data from the NSDAH and MTF suggests that roughly 65% of college students drink alcohol in a given month. That's a lot of alcohol when you think about it, and that is a very high number of a college campus, no matter if it's small or large.
So going back to what Nick said, according to the Journal of Epidemiology of Binge Drinking among college-age individuals in the United States, binge drinking is most prevalent in late adolescence or early adulthood, with rates declining and drinkers growing older. Binge drinking, primarily among college-age individuals, has a significant topic of research for more than 20 years of associations between greater quantity and frequency of alcohol consumption and alcohol-related consequences. Binge drinking among young adults has concerned researchers and educators for decades, prompting multiple national initiatives to track patterns in binge drinking. The primary populations for the binge drinkers in college, according to the Journal of Epidemiology of Binge Drinking among college-age individuals, the CDC reported that more white college students engaged in binge drinking in the previous 30 days, 31.6% of females and 49.4% of males than Hispanic students, and also African American students were less likely to report binge drinking than white students, although this difference was less pronounced among females. Rates of binge drinking have also been assessed in military samples. Starting in 1980, U.S. Department of Defense issued several large-scale anonymous health surveys, most recently called the Health-Related Behavior Survey, to active duty military personnel, with the first assessment of binge drinking appearing in 1998. The rates of binge drinking for military personnel overall have increased from 35% in 1998 to 47% in 2008. The 2008 survey sampled more than 2,800 service members and found that young adult military personnel ages 18 to 25, which is the population we're talking about, have the highest rates of frequent binge drinking once a week or more at 26%. This significantly higher rate for same-age civilians, as reported in 2007 NSDUH, as Nick mentioned before. Rates of binge drinking also differ by military branch. So associated health outcomes related to binge drinking. There's physical and legal outcomes. Binge drinking is associated with significant increased risk for experiencing consequences, including physical harm, legal problems, and failure to meet the role obligations. Active duty military personnel who binge drink are about 5 times as likely to report drinking and driving or riding with someone who has been drinking. College students who binge drank in the previous year were more than twice as likely to be taken advantage of sexually unplanned sex, and they were 4 times to be physically injured. Additionally, individuals who engage in frequent binge drinking reported experiencing more sick days and having poorer overall health and mental health than non-binge drinkers. Binge drinkers also reported having greater sleep problems, including having more trouble falling asleep and staying asleep than those who not binge drink. Binge drinking also increases an individual's likelihood of driving after drinking.
Hey, my name is Garrett Schwarter, and according to White and Hickson, they got data from the Harvard CAS and other studies to reveal that males, Caucasians, members of Greek organizations, and students on campuses with lower percentages of minority and older students, also athletes and students coping with psychological distress, are more likely to excess drink. Also, students with access to cheap drink specials and who are willing to endure the consequences of alcohol misuse and drinking at off campuses in Greek housing, and also people who try to fit in and those with positive expectations about the results of drinking are more likely to binge drink as college students. Also, students deal with anxiety a lot, so the students like to binge drink that have anxiety. So social anxiety has been shown to be related to drinking among college students in several studies. Using a structured diagnostic review, Kushner and Shear found that having a diagnosis of social phobia significantly increased the risk of also having a diagnosis of alcohol abuse or dependence among college students. Goodwin found that a common reason college students reported for drinking was to meet new people because they were shy, and including members of the opposite sex. College students also report drinking to be sociable, to fit in with others, and to feel less shy, according to Kuros and Demers. Social phobia is also comorbid with substance abuse, according to Stein and Maltier. Therefore, some individuals who abuse alcohol may be drinking in response to their social anxiety. Further research found that it is best mixed and documented that college students with parents who have alcohol-related problems and grow up in with alcohol drinking parents who love to drink on the weekends and drink every day after work are more found to drink. For example, Ings reported that rates of drinking were way more with college students who do and do not report a history of parental drinking problems. Alterman and Harvey reported similar results. Consistent with research and dictating the students who are more likely, with research and dictating the students who are more rebellious and less conforming to traditional values, studies show that students who are more religious and more committed to traditional values drink less. For example, the reasons students give for limited their drinking have been characterized as reflecting their upbringing, performance, and self-control reform, according to Greenfield. Brennan suggested in a review that there were some suggestions that the relationship between self-esteem and drinking was stronger among females than males. Brennan also identified 8 studies to examine the different motives for alcohol consumption among college students. Two general types of drinking motives typically emerge in studies of college students drinking for social purposes and drinking for emotional escape or relief, according to Brennan. 5 studies associated escape motives with increased drinking and related problems among college students. However, at least one study documented increased frequency of intoxication associated with motives to drink for getting drunk, according to Wessler and Roman. And that's it for my part.
How are you doing? My name is Jonathan Earl. I'll be explaining the education effort programs for our project. And according to the NIAAA, which is the National Institute on Alcohol Abuse and Alcoholism, a program called College AIM, which stands for the College Alcohol Intervention Matrix, is a user-friendly interactive decision tool based on growing literature on campus alcohol use prevention. According to Jessica Krantz and the NIAAA's College Alcohol Intervention Matrix, it includes strategies targeted at both the individual and environmental levels. It reflects the collective knowledge of 16 separate experts in the field, which makes it unique relative to other summaries of the science. In the article, it also goes on to say that College AIM identified 14 strategies as having some effectiveness in the individual focus strategy matrices. Of these, the researchers have deemed 8 to have higher effectiveness based on the requirement that 75 or more % of the studies evaluating a given strategy reported a reduction in alcohol use or related consequences. The program hopes that by using a combination of effective individual and environmental focus strategies, colleges can create sustained reductions in risky alcohol use and related problems among their students. Krantz also goes on to say that College AIM also identifies 19 strategies as having the degree of effectiveness in the environmental focus strategy matrices. Of these, 5 were deemed to have high effectiveness, retaining to the minimal legal drinking age, or the MLDA, of 21. Enforcing the MLDA increased taxes on alcohol, retaining a ban on Sunday alcohol sales, and enacting bans on happy hours and other price promotions. Although retaining the MLDA of 21 remains one of the most highly effective environmental interventions. What does not work for this program is the lack of promotion and information about the program itself. Although what does work is it helps with strategies, making it more effective, like colleges can partner with other organizations that influence policymakers to implement or retain these policies. Colleges can also talk individually with local bars and other venues near campus that serve alcohol and ask them to restrict happy hours and other price promotions.
In conclusion, the information that Garris, JP, and Jonathan conveyed was very instrumental in this project. Going over a couple key points, such as this, according to Krantz, in the college alcohol matrix, colleges are trying to increase the taxes on alcohol, retain a ban on Sunday for alcohol sales, and also enacting bars on happy hours and other price promotions. And also going back to the campuses, they also some campuses are even thinking about implementing the dry campus rule, just to keep away from all the bad things, so to say, for binge drinking. Binge drinking, particularly among college-age individuals, has been a significant topic of research for more than 20 years because of association between greater quantity and frequency of alcohol consumption and alcohol-related consequences. Binge drinking among young adults has concerned researchers and educators for decades, prompting multiple national initiatives and track patterns in binge drinking. All that to say, in college, people feel like they need to have a good time. Also, it's a time where a lot of people tend to find themselves, and drinking it's not so much of a negative thing, but the repeated abuse can be very detrimental. And just the fact that you keep doing it more and more and more, if this becomes like a repeated thing or repeated abuse, people won't even realize that they're harming themselves or even setting themselves up for alcoholism down the road, or either just like creating so much damage to their liver already. So with this information, this really opened our eyes as a group to the horrors of drinking for college students, or just being a responsible adult with drinking, period. And we hope that our binge drinking project really help you guys understand as well.